Good morning, welcome. I'm Jessica Balboni from the League, and thank you so much for being in this session on health, wellness, and music. I would love to begin by just introducing our panelists today. To my immediate right is Cynthia Briggs, the director of the music therapy program at Maryville University here in St. Louis. And next to her is Lisa Dixon, the executive director of the Portland Symphony. And next to her is Jennifer Barnett, the director of education and community engagement at the Knoxville Symphony. And then we have Crystal Weaver, music therapist at the St. Louis University Cancer Center. And finally, Maureen Byrne, community program manager of the St. Louis Symphony. Welcome, panelists, and thank you so much for being here. Today, we're going to be focusing on learning from some of the orchestras that were funded through the League's Getty Education and Community Investment Program. And we're going to begin by just hearing a little from Cynthia on the research that informs the work. So we're going to start with kind of setting the context, and then we will hear from the rest of the panelists about the specific work their orchestras are doing in this arena. And then we're really turning it over to all of you for both question and answer, and we'd love to have some breakout sessions, and we'll tee that up later, but it's your opportunity to speak with all of the panelists in a more intimate way at the tables. So thank you. Cynthia.
Good morning. I'm delighted to be here. I'm going to just do this tiniest little sort of crash course on why music is therapeutic, because I can't resist having an audience to talk about that with. But also to maybe give you a little bit of language as you begin to think about needing the right words to talk about why these kinds of partnerships are so important. But my real job here in the next just few minutes is to sort of lay the groundwork for our conversation about how these partnerships work and what kinds of things they've been doing. So your experts are coming up and they're going to talk about the projects they've been doing. So why is music therapeutic? Music is learned and stored diffusely across the entire brain from brainstem to frontal lobe. So unlike many functions, such as speech, which has speech centers in the brain, and when they're injured, then that function is very, very difficult to reacquire. Music is very diffusely stored, which makes it a great access tool, makes it a great resource for retrieving information in alternative ways. The earliest sounds we make contain the elements of music: rhythm, phrasing, accent, and tonality. When they study babies, they're already using those elements. So very, very early on, long before there's language, we're communicating by using all those elements that we think of as the elements of music. Rhythm is an organizer and a driver. It directs motor movement. It organizes musical and non-musical content. So we can use rhythm to put information, embed information, or to drive motor movement very easily. Music's also processed by our auditory cortex and our limbic system, so it connects directly to our emotions and memories. We all know that. We've all experienced. We associate positive affects to the music that we enjoy the same way we do our favorite foods and our favorite people. So again, you can map, do brain work, MRIs, things like that, and people are lighting up the way they do when they eat chocolate. So we love music the same way we love people and chocolate and things like that. It's very, very powerful. We connect strong memories to music that are embedded in and the memories are embedded in the music. So when we re-experience the music, we re-experience the memories we embedded in it. Again, we've all had that experience, but it becomes a resource for helping people retrieve memory, think about emotions, think about meaning, and so music therapists are often using these kinds of tools to connect to people. This is just a quick link from the New York Times last week. Dr. Zatori and his colleague Valerie Salampur did this nice little article. I give it to you only as a link, and we'll only talk another 30 seconds about it, because it's sort of much like I just did for you. It's kind of a concise little piece that you could give people when you're trying to talk to them about why music is more than just it feels good to listen. Music therapists are often talking about why music is more important than just because it feels good to listen. That's a very, very important piece of music, but there's so much more power in music as we come to understand it. There's also a wonderful piece, which I didn't get a chance to put the link up here, just this week by David Brooks, who is an op-ed writer for the New York Times, on sort of how neuroscience is beginning to make all sorts of decisions, and sort of we're beginning to use neuroscience to explain everything, but we forgot that there's the mind, and we forgot that there's personal experience, and that what struck me when I wrote it is what makes music powerful is that it's so incredibly personal. And so we can get very, very close to somebody by understanding their music and what that music means to them and what it's been in their life. All right, I'm done with my preaching. The rest is, we're going to kind of talk about the partnerships that have been built. What my slides do is basically outline our conversations this group has had about how these partnerships that they're doing have unfolded. And they will come in and kind of talk with great expertise. But let's look at that briefly. When we talk about partnerships, we're talking about engaging other organizations in shared goals regarding the use of music in health and wellness programming. So how do different kinds of entities, universities, orchestras, cancer centers in our case, come together and have shared goals about why we're partnering? We want to think about those shared interests and goals. We want to think about the strength that each partner organization brings. What are the strengths that the Cancer Center brings that the university can't bring, et cetera, et cetera. How do we identify the needs to make a partnership work? How do we educate the partner members about what the others do? We've done a lot of educating, which Maureen is going to talk to you about, the symphony members about when you walk into an infusion room, what are you talking about? What's going to happen there? Ongoing listening, ongoing dialogue, and then post-op, reviewing regularly, evaluating and revising and reviewing, how did this semester go, how did this year go, how did this 8-week block go, constantly looking. And then some self-evaluation, and we've also built in, each of these are going to talk to you a little bit about how they're going to build in some research. Let's start first talking just about those shared interests and goals. What does each partner hope will be the outcome of this partnership in music and health? Is it realistic and possible? And that's probably one of the best or first dialogues you want to have. What do we all want to do in this partnership? What do we want to have happen? And do we all between us have the tools to make that happen? And then, you know, is that realistic, or what needs to be modified so that this can be as successful as we can anticipate? And sometimes, you know, somebody comes to a partnership with a goal that isn't realistic. Somebody else might come to the partnership kind of a little resentful that something's going to happen. All of that needs to be sorted out so that everybody has the same goal and has a clear understanding of what can happen, and maybe gives up a few things that can't happen. The expertise may not be there in that partnership. Does each partner clearly understand what the other does and doesn't do? We did a lot of educating the symphony about what is music therapy. Nobody has trouble thinking that music's therapeutic, certainly not in this room, right? But then, what does that mean? What does a music therapist do all day with their time? So just understanding that it isn't a case of going in and playing for someone so that they get to listen to something pleasant and maybe they feel better. We've made decisions about the music that's in the therapeutic situation, so that we might be looking at respiration or blood pressure or heart rate. We might be looking at motor movement. We might be looking at depression. So music therapists are making decisions about music based on goals that are therapeutic in nature or therapeutic needs. Likewise, we needed to learn what the symphony players coming into an infusion room, and I'm not going to talk any more about it because the others are going to tell you, what they could bring, what they feared, things like that. What does each partner need to be successful regarding their component of the partnership? So we've decided what people's components are. What do they need to succeed at it? If we've decided somebody's going to take one component of the project, but they really don't have the support, whether it's financial or staff or whatever it might be, it's not going to fly. So once we decide on the partnership, we need to understand. And then creating shared goals for each project. In terms of identifying the interests and needs, you probably want to survey the members of the partners. If you are going to put together a symphony and a hospital, you may want to really decide who the main players are, and you're going to hear about some surveys that have been done. And understand exactly, some kind of survey that gives you information about each of the people that will be participating, including perhaps clients or patients. What do they need to be successful? We've sort of said that. And then educating all the partner members about the project and what each organization will do. That sounds so obvious, and yet I think every single person here is going to tell you, educate, 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 followed by, in the next slide, listen, listen, listen. Because if people don't understand the goals and what everybody's part is and what that person or that partnership or those individuals are going to bring to it, then there's going to be this assumption, oh, well, she took care of that, he took care of that, that's part of something else. So clearly spelling out the pieces becomes really important at the front. And then be sure your projects are need-driven. There really is a need for what you created. If you create something brilliant and creative, but there's not really a need for it, then you need to either revise it or you need to take it someplace where it's needed. That to do something really creative but nobody's really looking for it is not effective. Ongoing listening and dialogue. Initial surveys and dialogue regarding it, and listen, listen, listen. Listen to your partners, listen to the program recipients, listen to the community. You know, it sounds like location, location, location. But every single person here is going to tell you that we went back and talked about this, we went back and surveyed this, we went back and reviewed this, we evaluated after this part was done. That understanding each piece in terms of how effective it was, what we could change, what people needed that wasn't there becomes so important to keep moving forward. And then self-evaluation. Build in from the very beginning some kind of self-evaluation process. Okay? So at the point that you think you have a whole lot of pieces put together, then decide how all along the way we're going to evaluate it. We're not going to wait until we've been running this 3 years and then say, let's evaluate and see how it's working. You want to have something from the very start that you've identified, even if it's just a simple questionnaire, survey, a meeting every so many weeks, months, something that you come back and you look at it on a regular basis. Structure the projects when possible so that there can be good data collection and can later lead to sharing results. So again, can you build in from the very beginning a way of getting data or feedback from the participants, both the partners and also those that are recipients of whatever you've created, so that you not only are hearing from them in that listen mode, but you're also getting, in a sense, data that allows you to report out what you've been doing. It allows you to talk about the effectiveness of what you've created. And then evaluate and learn from all the data you collect, no matter what level it is. So when you talk about data collection, there are things like ordinal and interval and types of data. If you're only doing a survey, if you're only doing a phone call, if you're only asking each patient that's seen to answer 3 questions, maybe it's something very simple. It's still data. Don't diminish it. Hang on to it. Have a method for storing and retrieving and reviewing that information, because when it comes time to talk about the grants you've received or talk about another grant and funding, that all becomes a way of substantiating the effectiveness of what you've created. Okay, thank you.
Just so you know, we have PowerPoints all on our conference website, as well as the app of all of this, so you can access those.
Wonderful. Thank you so much, Cynthia. That was a wonderful introduction. I'm with the Portland Symphony, and we are relatively new on our journey in this department. So this has been a real wonderful journey, and the Getty Foundation has made this all possible for us. So we're thrilled to be here today and here with all these wonderful women who are doing such great work. So I just thought I would share a little bit of detail about our experience on the ground in case that's helpful for each of you. And just to give you a quick perspective on what we're doing up in Portland, Maine, we're really focused on our partnership with an organization called the New England Rehabilitation Hospital. So I brought some pictures just to share, just to give you a little bit of a visual about what I'm talking about today. Maybe. This is our planning team. Those are a couple of our musicians. Our musicians are at the heart of everything we're doing with this program. And we have an occupational therapist and a music therapist as well working with us. There's really 2 arms to our work with this organization. It's focused both on employee programs. So these are employees of the hospital working, and there's musicians playing in guided movement exercises. You can see them there. So that's one arm. Really, you know, it's a stressful work environment for them in those hospitals, taking care of these patients day in and day out. And so our focus on this arm of what we're doing with them is how can we use music to help their employee satisfaction and stress management that they're dealing with on a day in, day out basis. And then the second arm, which was really brand new for us, is really around patient connection. So we call this our Music for Life program, and what you're seeing here is actually our musicians plugged into one of their existing movement classes, so really incorporated right into the therapy work that they're doing on a daily basis. You can see them there with, doing movements while the musicians are playing, and then some guided listening and meditation work as well. And this was families as well, so we've connected with the families and the patients, really looking at it in a holistic sort of way. I think this is a video, if we can play, just to give you a quick snap of what the... Great. So you can just get a flavor for what our work is like there at the hospital. But the most important things I think I wanted to share with all of you today is the learnings we've had really about the importance of that partnership and of that dialogue, and making sure that it's really truly based in shared, mutually beneficial goals for the program and the needs that each organization has. So from the symphony's point of view, our mission is to serve our community by enriching lives through music. And we do that in a number of different ways, and one of the ways we do it is at our concert hall, of course, but we're looking to really expand the ways that we can do that in other ways, in other environments, in other venues around the community. And so this is a very core central part to what we're doing as a symphony, to find new ways to connect to people in the community. And from the hospital point of view, they're constantly striving to find new ways to really strengthen their employee satisfaction rates and really increase the experience that their patients are having in their facility. So we actually learned in our dialogue with them that they, as part of the changing healthcare standards and rules that they're dealing with, is a lot of their funding is actually directly tied to their patient satisfaction surveys. It's an actual survey that every patient has to fill out as they leave the hospital. And so they're looking for ways to constantly try and make that experience better and improve those ratings that they're getting from that. So there's a real shared foundation of what the goals are and what we're hoping to achieve. And all of this is centered on this planning team that we have. And we have on that planning team, it's really key to what we're doing. We have the folks from New England Rehabilitation Hospital, we have symphony staff, we have musicians, which I think is probably the most critical aspect of this, in the room as we're understanding what the needs are, what the constraints are, how can we make these the most valuable partnerships that we can. So, it's just a couple of quick examples of how that dialogue has really saved us in a number of situations. We did our very first program for the employees, and we thought it had gone so well and so great, and we had this full room of employees that had gone through the full thing the way we had set it up in the cafeteria, and we gathered all the surveys at the end, and we quickly went through them to see what had happened and what their feedback was, and they all thought the program was great, but they we're actually finding that they were more stressed out by the end of the program in that first one, just because of the way we had situated the room. And we actually had the musicians sitting by the window, and so what was happening is they were seeing their coworkers go to their car and go back and forth outside of the room and thinking, oh, I forgot to email that person, and I forgot to call, and I need to do this, I need to do that. And so we quickly realized that we needed to change that, and we immediately switched the entire room around and got much better results the second time. So, sometimes the littlest things, it's just amazing. But just really great dialogue, understanding how we can plug in and make it as easy as possible from the hospital's point of view about when we're doing these programs, whether it's on the weekends or weekdays, and whether it's an add-on or an existing partnership. But I think it's just been great learning, and our musicians have been fantastic. We actually did do a survey of the full orchestra to determine who was really interested, who was really passionate about this type of work, and as a result of being able to get that sense of our orchestra, we've been able to find musicians who are so eager to get in there and to listen and to help us figure out how to make these programs as strong as we can. So happy to talk more about all of this later at the small groups, but stop there.
We at the Knoxville Symphony have been doing this work for a little while now. We actually started the program in 2003, and unlike some of the other things that you're going to hear, we sort of came into this program, I think, from the back entrance. And since in the past 10 years have sort of worked our way around to some of the great models that you're going to see here today that are actually starting from the beginning in a certain way. But just to give you an idea of the scope of our program at this point, we started in 2003 with 16 performances, and those were in assisted living facilities to begin. Since that time, we have expanded to 88 individual performances each season, and we reach about 6,000 in our region. That works within 4 different partner healthcare systems. We have several competing healthcare systems in Knoxville and have been able to gain entry into several of those different systems. Our musicians work as soloists or as a string quartet, just depending upon the area of the hospital in which they're working. So we're currently serving the University of Tennessee Medical Center, and they serve as our main partner in the program. We do work in several different areas within the UT Medical Center, beginning with the Cancer Institute, which is our primary partner in the program. And in the Cancer Institute, we are on inpatient floors working in oncology, and then also in main waiting areas, such as this picture. And I love this picture because if you'll notice, our first violinist is looking down to consult our new decibel meter, which is now informing all of the different work that we're doing in these different areas. We work directly in the chemotherapy treatment bays with a solo musician, and also in the neonatal intensive care unit. And just to give you an idea of how our program has changed, particularly in, say, the last 6 years, and this one is actually documented on film, which is great. This particular musician entered this patient room and moved to the side of her crib where there was more area for him to play, being conscious of his violin bow and the way he needed to hold the instrument. And the patient turned her head to the right, tracking the music as he entered the room. Now, what we didn't know about this particular patient was that she had had reconstructive surgery on her neck soon after being born, and before this time, she'd only ever turned her head to the left. So that in contrast, that in contrast to what we're doing now in the neonatal intensive care unit, where recently a solo musician went in with our music therapist, and after 2 to 3 minutes of entrainment work, which is matching the rhythm of the music to the rhythm of something in the patient's body, after 2 to 3 minutes of this kind of work with several different infants, we were able to note that heart rates had decreased from levels in the 170s to levels in the 140s, and that blood oxygen saturation levels had increased from 89% to 98%. So just in the last 6 years, we've been able to go from these anecdotal types of things to actual measurements that can be documented. Our musicians also work in the cardiovascular unit in UT Medical Center, and our second partner in the program is the cancer support community of East Tennessee. We do a little bit of work with brain injury rehabilitation and on inpatient floors for senior care, and are still continuing our work with assisted living facilities throughout the region. The most exciting development in our program, I would say, in the last 10 years, and through the specific support of the Getty Foundation, is the addition of a music therapist, a board-certified music therapist, to the KSO staff. This is a part-time position that developed out of a needs assessment in our community. When we began the work in 2003, there were no music therapists working in East Tennessee. Since that time, we have 3 now working in our community. Ours is the only music therapist that is working within a hospital system in East Tennessee. So we are sort of pioneering this activity for our region. And this is a jointly funded position with KSO funding the salary for the position. The University of Tennessee Cancer Institute provides clinical space within their integrative medicine suite. Cancer Support Community provides clinical space, and UT Medical Center also provides a benefit stipend as well. And her role is to provide individual and group therapy sessions for both the Cancer Institute and the Cancer Support Community. And then she also directs our KSO musicians who are working within the program. and I have a video that we used. This was her introduction to the cancer support community and the kinds of activities that she was going to be leading there. So take just a few minutes.
As we move forward with the KSO Music Therapy position, we decided to combine the Music and Wellness Quartet with a music therapy. I chose an evidence-based West African drumming technique that is very effective for high-functioning populations. This served as the basis for layering musical components of seemingly unrelated entities, in this case, string quartet and clients with cancer, to create a unifying experience. For a little bit of a surprise, we'll do it in a minute. So when I put my hand up, we start, and when I bring it down, we stop. Are you ready? Just playing kind of whatever. We won't worry about a rhythm. We won't worry about being perfect. Just make some sound. Ready? Again, no journey is perfect. All right, are you ready? But by the amount, tone, and quality of interactions that are occurring within the activity itself. And it is those interactions and behaviors which meet the larger goals of fostering connection, community, support, and positive musical experiences.
So our work this season has primarily focused on professional development for our musicians, which intuitively should have probably happened in 2004, right after we started the program, but we are getting there just now. Our music therapist has worked with them through observations and then also through individual professional development sessions, which so far have covered interactions and interpersonal skills, volume and dynamics in terms of what decibel levels are appropriate in different areas, making the shift from performer to provider, transference and countertransference. And in the fall, we're going to be talking a lot about how to organize repertoire for different areas of the hospital in which our musicians are working. Also looking a little bit at caring for the caregiver in terms of the actual health and well-being of our musicians that are doing this kind of work in some sometimes tense situations. We also began training our musicians through the Music for Healing and Transition program, which is a 5-module program at the end of which they will become certified music practitioners. We've already completed Module 1, and that module covered patient assessment for live therapeutic music. And in this session, we learned about general guidelines of what to look for when entering a patient room, and then how to connect what we've learned and what those conditions might be with types of repertoire that would be appropriate in that situation. In the future, we're going to learn about music as a language, the paradigms of healing, music, sound, and healing, etiquette and internship, alterations in health, and care of the dying. And this program also includes a 45-hour internship in which our musicians will do actual clinical work in the field to fulfill their requirements. And one of the great challenges that we have faced in the program over the last 10 years is what repertoire is appropriate. Our music therapist is asked all the time, so what's the best kind of music to use for people? Is classical music the best? Is rock the best? And the really difficult answer is that it really depends on the patient. So much of it is connected to what patient preference is. So it's been a challenge to prepare for acute situations such as oncology and cardio, and non-acute such as waiting areas and working with senior populations. I'm also receiving training this summer through the Arts and Healthcare Summer Intensive at the University of Florida. And the neat thing about this program is that it has a clinical and administrative hybrid track. So I'll be covering program administration, funding and sustaining program, the arts in public and rural health, research and evaluation, and then the arts and healthcare from a clinical perspective as well. And through this work over the last several seasons, we've identified a couple of overarching questions that are ever present in my mind as we move forward, because I think they are things that our industry is going to have to answer while doing this work. And the first of those is, how do orchestras integrate professional musicians into healthcare settings in conjunction with a music therapist? Bearing in mind that music therapists have years of academic and clinical training in their field. And generally, when they go in to provide an intervention with a patient, they are the ones that are actually providing the music in that situation. So how do we take professional musicians who have not had this training and put them into these situations with music therapists? What does that relationship look like when it functions the best? And then where are those boundaries between volunteer musicians that are working in hospitals, music and healthcare programs, certified music practitioners, and music therapists? And the second is, how do musicians and how do organizations justify providing music that benefits patients, visitors, and staff in healthcare settings with our artistic goals? As you well know, our musicians are constantly evaluated on the quality of their musical playing. And so what we are finding in these situations is that the types of music, the levels that the music is played, are not always cohesive with those overarching artistic goals that our organizations have. And so we need to think about how we make the shift from performers to providers.
Hi, everybody. I'm Maureen Byrne. I'm the Director of Community Programs here in St. Louis. So welcome to St. Louis. I hope you've had a great few days here. We've been delighted to have you. I am constantly inspired. I'm very inspired by Lisa and Jennifer's stories. They have tremendous programs. I think it's interesting to see the variety of programs that can work very well depending on the population that you're serving. We're also grateful to the League Getty grants, because I think without that support, we wouldn't be quite as far along as we are right now. So thank you. We're currently involved in 3 healthcare programs here in St. Louis. 2 have just gone through their pilot years, but 1 has gone through a pilot year and a second very successful year, and that's what I'm going to focus on today. Our local NPR station and reporter Rachel Lippman did a fantastic story about the collaboration we have with St. Louis University Cancer Center, and we're going to go ahead and play that for you.
Time. Yeah. And this is Ann The St. Louis Symphony doesn't rehearse on Mondays, so cellists Bjorn Ronheim and Ann Fagerberg are getting ready to play a concert instead. The process is the same as if the duo was at Powell Hall. Set up the stands, arrange the music, adjust the chairs, tighten the bow, tune the instrument, wait for the cue, and play. But their stage today is an open patch of floor in the St. Louis University Cancer Center's Infusion Room. Ronheim and Fagerberg's music can't fully drown out the beeping of machines or the snap of tourniquets and gloves, but there's a marked change in the atmosphere as they begin to play. One man gets a faraway look in his eyes as if the music has triggered a memory of better days, and Mary Mowney leans back in her chair and closes her eyes.
Springtime and sunshine and all good things.
Mowney comes to SLU from Union, Missouri 3 days a week to treat her acute myeloid leukemia, so she's familiar with the drudgery of chemotherapy.
Usually if you're just in there sitting getting fluids or waiting for blood tests, there's nothing to do. But this gives you something to listen to and to focus on. Just makes you feel better.
The Symphony's monthly performances came out of a 2010 committee that studied ways to manage the pain of cancer treatment, says Dr. Mark Varvaris. He's the director of SLU's Cancer Center.
The more we learned about music therapy, the more we decided that we wanted to know more about it and establish a program here.
A St. Louis Symphony staffer on the committee brought the idea back to the symphony, and about 2 years later, a music therapy program was born. Patients who must be hospitalized during their treatment receive one-on-one music therapy sessions. Students at SLU's School of Music play in the Infusion Center on the weeks the symphony musicians do not. Music therapist Crystal Weaver provides the individual treatment with help from music therapy students at her alma mater, Maryville University. She also helps the musicians select their repertoire. SLU is not the first cancer center to collaborate with its local orchestra, says Weaver, but the depth of that commitment plus the scope of the program make it unique.
That would be a nice feather in our cap if someday we were the gold standard of other cancer centers to follow throughout the United States of how to have a comprehensive music therapy program.
Research dating back to the 1940s has found that music reduces anxiety. But Varvaris, the cancer center director, says there aren't a lot of well-designed studies that evaluate the effect it has on pain. So, using a grant from SLU President Lawrence Biondi's research fund, Varvaris will look at whether music therapy, either individually or in the Infusion Center, has tangible benefits.
We can tell that these interventions do make a difference. We just want to be able to further show medical professionals that this is a real intervention. It's not entertainment, because not everybody believes in it.
Varvaris says he expects positive results and ultimately cost savings for patients and the center. But he says SLU remains committed to the program even without scientific evidence of its success. And that's good news for symphony cellist Bjorn Ronheim. Any public performance is its own reward, he says, but the Cancer Center is one of the best venues.
A lot of us do education work, which is wonderful, but what a better way to help the community than actually helping people who are going through so much pain. I think it's really a wonderful chance for us to give a little gift.
Ronheim says the Infusion Center also gives the musicians a chance to play in smaller groups, something he especially enjoys doing with Ann Fagerberg. Fagerberg returns that compliment, and she says any apprehension she had vanished when she began to play.
The clapping, at first, I thought, oh, you don't have to do that. But then I thought, they should do whatever they feel comfortable doing. So it was perfect.
Both say if the opportunity presented itself again, they would return to the temporary stage, instruments in hand, to once again help the audience escape for just a little while. I'm Rachel Lippman, St. Louis Public Radio.
Jennifer and I were talking earlier and decided there must be a designer of infusion rooms, because the infusion room in Knoxville looks just like the infusion room here. Key to the success of this particular program is the commitment that St. Louis University Cancer Center brought to this from the very beginning. We knew we had an expertise in one area, but we were definitely not music therapists, nor were we equipped to operate in this environment. And so SLU Cancer Center made the commitment to hire a full-time music therapist to implement a very comprehensive program. Our part of the program is this much of a much bigger program that Crystal runs. So Crystal, sitting here with me, is my partner, and she has just been terrific in helping us define what it is our role in this comprehensive program really is. So we know, going into each season, how many musicians are interested in our Monday morning performances in the Infusion room. One of the measures that I use for success for this program, and you'll hear about many other measures in a minute, but one of the measures I use as success is how many musicians ask to be a part of this program. And it started out, you know, I was kind of recruiting the pilot year. Because, you know, everybody was a little bit concerned about what was going to be required of them. Last year, after our pilot year, we actually ended up with more musicians who wanted to be a part of this effort than we had spaces for. And just this morning, I checked to see what our enrollment is for next season and how many musicians are interested in this program. Mind you, we have one visit a month at this stage with a musician duo. So, and we run it from October through June. So really, I only need 18 musicians, and I'm not sure what I'm going to tell all the musicians who want to be a part of this program. We might have to visit more frequently, I'm not sure. We'll talk. So what makes Crystal so wonderful being there is that she's able to do some professional development with our musicians. It's very informal professional development. It's basically setting expectations, showing photographs to our musicians about what they can expect to experience, hear, see when they visit the Infusion room. We really are talking basics. She comes and visits for an hour during lunch between rehearsals. It's very informal. And just kind of answers questions that the musicians have. We also have a handbook that we give to musicians. It's very simple. It's just, you know, 8 pages long. It's very simple. It tells them where they need to park. It tells them, it makes suggestions on what kind of repertoire they should bring to the Infusion room. Basically, it takes all of the stress out of making this visit, especially for musicians who are visiting the first time, because the last thing that we would ever want to do is send stressed out musicians into an environment where it's really sensitive. They need to be very calm. Crystal also sets the expectations in the Infusion room. You know, we don't just walk in there and go, hey, we're from the St. Louis Symphony. She has already talked with the patients. They know who's coming. In fact, we'll know by the end of this summer which musician duos are going to be at the Cancer Center each month all through next season, and Crystal will be able to tell patients that. So that really helps a lot, just to know that we're coming, and the staff knows we're coming. And so, it just de-stresses any kind of discomfort that could come up by just walking in. There's also paperwork that needs to be addressed whenever you visit a sensitive environment like this. Crystal takes all of our musicians through the HIPAA requirements. One of the points I wanted to just let you guys all know about is when we were putting this program together at the very, very beginning, we addressed, gee, what is the right combination of musicians? Well, it's not necessarily an instrument type. You saw a trombone in the Infusion room. It's the number of musicians. And we thought that it was too difficult of an environment for just one single musician. But it was too small of an environment for 3 musicians. So we have settled on musician duos, which has worked out extremely well. They sign their HIPAA agreements. They can't talk to their families at home about what they've seen in the Infusion room, but they can talk to each other. So it's a little bit of built-in psychotherapy. And, you know, it is a sensitive environment, and we found that the duos work really, really well together, and nobody has you know, suffered any kind of depression or there have been no problems for the musicians coming out of this. So bottom line, having Crystal and her team. By the way, this is the SLU Cancer Center table right here. And Crystal also always has an intern from the Maryville Music Therapy Program working with us, and they're with us every step of the way when we're in the Cancer Center. And you know what that does is it makes sure that the patients have a very confident and comfortable experience, and the musicians have a very confident and comfortable experience. But she also brings in expertise from a scientific point of view that I'm going to let her tell you about, because like Jennifer's actual hard data and assessment, Crystal has implemented something very similar.
So I think one of the things that Maureen and Jennifer and Lisa have really touched on during their portions of the presentation is what a good experience it can be for both the musicians and for the patients or clients when you do partner with a music therapist. They do have the training of working in healthcare and being in that environment, but then they also have training of being musicians. So not only can they interact with the patients and clients in that environment, but they also feel very comfortable interacting with the symphony musicians who come in as well, and anticipating their needs and knowing what their questions are going to be, and helping normalize the experience for the symphony musicians at the same time. One of the best benefits of partnering with a music therapist is your ability to incorporate formal research into your endeavors with the healthcare organization that you partner with. Music therapists do have that training on how to conduct formal research, how to do the data collection, how to get through an institutional review board so that you don't have to take that piece of it on. We're very committed at the SLU Cancer Center to conducting research with the symphony musicians that come in, how their performances engage and also physically change what the patients are experiencing, and then comparing that with individual music therapy sessions. Like Jennifer was talking about, entrainment is a very vital piece of music therapy sessions, and that's something that we try to communicate with the symphony musicians at the same time, that tempo really does affect somebody's physical state. So when they're thinking about repertoire development, we get that question all the time as well. We try to tell them that it's not one style of music. So, you know, unfortunately, listening to classical music or nature sounds is not going to help everybody. I think that's one of the things that the symphony musicians from St. Louis like so much, is that they really do get to have a lot more creative control and creative freedom. We encourage the symphony musicians to play anything from 66 to 72 beats per minute, which is a little bit slower. When patients listen to music that's set at that rate, their heart, their pulse, their respirations begin to entrain or match the speed, and that's what we're going to be looking at. We measure blood pressure, pulse, respirations per minute. So we do encourage the musicians to bring in whatever type of music they want to play, whatever type of music they're comfortable with, but to really think about the tempo. And just because a piece of music is intentionally written to be played at 122 beats or 180 beats, in this environment and for this clientele, it doesn't necessarily mean that you have to play this piece of music exactly the way that it was written to be performed, that you can make adjustments to the tempo and the dynamics to better fit the environment and to better fit the needs of the patients. You don't have to have a huge research study that you're looking at 100 patients or 250 patients right off the bat if that seems very daunting. You can start something very small. You can do case studies where you just interview one patient at a time and get their perspective and their reaction, and that's something that you can publish. You can also just look at what Lisa was talking about satisfaction surveys. Every healthcare organization does have to have satisfaction surveys, so you can do something that you can incorporate a few, 3 or 4 or 5 questions about how patients felt before they listened to the music and afterwards. Do they think it was a better experience when they came into that infusion center or into the hospital because they had the music? And that's information that not only benefits you and your program, but that's also going to benefit the hospital and or healthcare organization that you've partnered with, so that you guys can have a stronger partnership, because it's mutually beneficial for everyone.
Well, we're going to open it up for some Q&A now, so if anything has resonated both among the panelists themselves and Cynthia, if you have any observations as well of what you've heard, love to hear that. But this is your opportunity to ask our panelists questions, reflections. Yes?
I'd like to ask Crystal what the ideal frequency and duration of music performances.
Yeah, we usually have, our performances usually last 45 minutes to an hour. That's a very important question, because you don't want to have the music go on too long, because music that is all day long, 8 hours long, 6 hours long, it becomes white noise. It can become as detrimental as not hearing anything at all. We also don't want to take up too much time of the musician. So usually 45 minutes to an hour per visit has worked very well. That's also, for our infusion center, that time length is usually very good, because then we're not completely disrupting the entire workday for the nurses and for the physicians that are there. I think one of the things you heard from the NPR piece is, she was really in the infusion center when that was recorded, so you could hear the volume level of people talking was there. You could hear some devices alarms going off in the background, and those things won't stop, but you could hear them diminish a little bit with the music as well. So 45 minutes to an hour seems to be best. Usually most music therapy sessions are 45 minutes to an hour. So. The symphony musicians come once a month. When we're doing individual music therapy sessions, we actually see the people once a day, Monday through Friday.
And you have students from SLU as well, musicians from the college. The university will also go in on days we don't go in.
Yeah, we have a partnership with the St. Louis University School of Fine and Performing Arts. One really nice thing is we're all really centrally located, and we're at right now. And so those students are encouraged to come over. St. Louis University really does encourage their students to volunteer in the community. A lot of the student musicians love to come to the Cancer Center to volunteer, because not only are they volunteering and fulfilling that requirement, but they're also doing something that they really enjoy, which is playing their instrument. A lot of those students, too, have the intention of going on to be physicians. They're pre-med majors, or they're going into some piece of healthcare, and they're minoring in music, so they love to come over to have the exposure to the environment, to get more comfortable in the environment, to make those connections with some of those physicians when they go on to medical school. So.
We've got someone here, Wendy, and then we'll get you Ken.
That's exactly what I was going to ask, because I'm involved in a performing arts school and a conservatory, and I wonder how adaptable this whole program is. More thinking about if there wasn't a partnership with a music therapist to work with these students to help train them in a sense, I can see that it could be very anxiety-producing for them.
Yeah.
And I just wondered about that.
Yeah, and that's one of the benefits of, like I said, having a music therapist on staff is, if you want to branch out and do something with, with students and a volunteer program, it's very adaptable. Some of the other reasons that students like to come that is separate from professional musicians coming is, they have juries and they have grades and assignments, and some of them don't always feel comfortable playing in front of large groups of individuals, and they kind of need to get over that stage fright a little bit. So coming into this environment, it's a very forgiving audience. They can, test out what they're going to do for their juries or for their next recital, and kind of have a smaller audience that can give them some feedback and encouragement. And a lot of students have used it for that purpose as well, and it has really helped them. And I think that really is one of our goals at the SLU Cancer Center. We want this to be a positive experience for our patients, but if we can also make it a positive and beneficial experience for any musician that's coming in, whether they're from the St. Louis Symphony or they're a student musician, that's even better, because then they will keep coming back and our partnership will continue to grow.
Super. Ken in the back, and then we'll get to you.
Do you intend to publish the findings?
Absolutely, we do. We just finished the music listening group with the symphony musicians this month. We're going to be finishing up the music therapy sessions piece of it this year. We're hoping if we get significant results and they're favorable that we can publish them. Yeah.
I just wanted to say I'm partial because I worked with Crystal Weaver at St. Louis University and I worked with the student side of it. And there was such anticipation for Crystal and her group to come to our university to work with the students that they ended up putting a lot of that on the resumes and helping them out. So it was a great marriage between the school and
I'll add that I have 2 SLU students coming into my graduate program too.
Super. We're going to go over here and then in the back of the room. Yep.
This might be inside baseball, but on this clinical assessment piece, what are these tools that you use to measure decrease in anxiety levels? Is that heart rate monitors?
Yeah, some common tools that are very easy to measure is blood pressure, which all you need is a blood pressure cuff and a nurse who knows who's qualified to take blood pressures. Pulse, which, doing this to take somebody's pulse, and then respirations per minute, which are measured by just counting how many times somebody breathes in 1 minute.
Are you finding then that, bottom line, that this does have obviously a very positive effect on folks that have stress issues?
I'm just starting to do the formal data collection at this time. We are seeing results that are favorable to us. We are seeing a decrease in blood pressure and pulse and respirations per minute. We do it before they listen to the music and then afterwards. Whether or not they're significant or not, I don't know at this time because I have to sit with our biostatistician. They have to be a certain level, but we are seeing a decrease.
So what might be the difference between having a live musician there and having a CD boombox?
That's a very good question. Live musician, the reason that live music can be more beneficial is because the musicians, when you have a CD, all you can do is press play and it's off and running. And unfortunately, in this environment, you are going to see people getting up and leaving, doctors talking, things that you need to maybe decrease your volume with, you need to pause for a little bit. And so it's nice to have those live musicians because they can control the music and they can change it and adapt it very quickly, where with a CD you can't do that.
So there's a real sense of intimacy here.
Absolutely. And there's a sense of, if you want to join in on connecting with
I also always say, remember that when you have live music, you have live vibration. It's there, it's happening. You forget that you're feeling music physiologically. So when someone's playing their instrument, you're getting all of the timbre and vibration of that instrument. That's very different than a CD, and it's just by that nature is more personal.
Yeah. And that's one reason why people continue to like to go see live performances by a symphony instead of just listening to it on CD. It's a very pleasurable experience for your body at the same time.
Question in the back?
Are the musicians, the professional musicians, paid through a community connections program? How do they?
Let's hear from our free orchestra people now on this. Yeah.
I'll jump in first. Yes, they are all paid for their time, both for planning and for the actual programs themselves. So it's it's part of our contract with our musicians. So that actually falls under a new section of our contract that's really about community engagement programs that we're doing.
Ours is the same in Knoxville as well. They are all paid. The musicians that are doing this work are a part of our core orchestra, so it is a required service for them. They are allowed to self-select to some extent the programs that they're involved in, and we have identified, I hope, the musicians that are the most talented at doing this kind of work. But funding for those services, in our case, actually comes from our healthcare partners. So they are paying to have these services performed in their particular healthcare institutions.
And we also compensate our musicians through a service exchange. So they earn, any of our musicians who enroll to be part of our community programs, they agree to take on 4 events in a season for a week of vacation during the season. So each visit to the Cancer Center in this particular case is worth 2 of those points or 1 event. So.
Other thoughts, questions? What about families of patients? And you also mentioned employees in healthcare facilities. Can you talk a little bit about that and how you serve those other 2 constituencies?
We're looking at that specifically in doing a little bit of research in main waiting areas. So over the next 2 years, we're not quite as sophisticated as St. Louis, but we've developed a tally sheet of different patient responses, mostly looking at body language, whether that progresses to actual contact with the musicians that are in that particular environment, and just measuring what some of those responses are. So we're not only looking at patients in those areas, but caregivers and family members that might be with them as well.
Yes. Okay, I'm curious about in the different orchestra situations, if you went through some deliberations about whether or not the musicians should receive the music therapy training and go on their own, or if they should go in partnership with music therapists, and what your dialogue was and how you weighed pros and cons.
I can jump in on this one. We simply don't have the resources to send our musicians through a music therapy program. I mean, honestly, the degreed program that is at Maryville University it's a 2-year master's level program. It's not just a light dip your foot in the water kind of experience. So really, we came to the conclusion that our musicians could bring one thing to the table, but we really needed the professional music therapist to bring what we couldn't.
And we wanted our musicians to have more training than they have at this point, which is why we found that certification program to be kind of a nice middle ground. Now, it does take, we are scheduling that over the course of the next 2 seasons, so it is basically 1 weekend every 3 or 4 months.
I'll come to you in a minute if you're not here. I was just going to say there's an interesting parallel if you look at how sophisticated orchestras have gotten with their in-school music education programs, right? This is foundational work going on here, and so we know that the classroom teacher partnering with the symphony musician, partnering with the music specialist, if there is one, with a critical partnership. And so too, we're hearing here, the symphony musician with the music therapist, and then with the hospital or whomever administrator. But what really struck me was that there is so much learning among the symphony personnel as much as the institutions, just as we learned in the journey of arts education. And that there's tremendous impact. You said you have more musicians than ever wanting to sign up. That this is an incredible engagement piece for musicians working in orchestras. That I think people yearn to be part of their communities. And that it is tapping that creative expression, but it's also linking with different people you may never have been in contact with. So it's powerful, and I think it's really a burgeoning movement, and I encourage people to reach out here, but also the league, to let us know if we can do any matchmaking for you, if you want to speak to anyone who has some experience in this. So we're going to go here and then over there somewhere. Yeah.
In addition to that online URL that we were given, I wondered if there were printed guidelines for that music therapy organizations have produced for orchestras who'd like to get started with this, but don't necessarily have a music therapist partner in their cancer center.
Yeah. To be written. It's a good idea.
I haven't. I mean, general through the American Music Therapy Association, there are some general guidelines through their website, but I don't know of anything specific to orchestras.
We can look into that as well, and see if we can post some resources. Who else had their hand up? You know what, actually, I'm sorry, Amy, and then we'll go to Yvonne. Yeah.
So I'm wondering if anybody's had any experience working with an activities therapist as opposed to a music therapist in an healthcare facility. It seems to be a more common staff position.
I'm not sure, specifically activities, but we have plugged into their movement classes where there's not necessarily music involved. So, that we partnered with one of the local therapists, an occupational therapist who was she works on day in, day out, crafting her sessions. And so we were able to work with her and the music therapist to help incorporate music into some of her courses. So that's where we're starting to branch into, and curious where it will evolve a little bit further.
We've also done a little in the brain rehabilitation area with physical therapy. These are mostly stroke patients. And so using music to accomplish some kind of physical goal, particularly when they're doing their work in the gym that particular day, we've had music to kind of accompany some movement activities.
What kind of interaction is there between the musicians and the patients and vice versa? Q&A or how do you play your instrument? Is there that component?
There can be. I always tell the musicians, I encourage them to do what they're comfortable with. Some musicians are very comfortable, doing like a Q&A and going around and talking to the patients individually before and after they play. Some musicians are not comfortable with doing that, so I always leave it up to the musicians to decide how much verbal interaction and one-on-one interaction they want to have with the patients who are there. Most musicians who come for the first time, there's a little bit of that anticipation and of the unknown and not knowing what's really going to happen. And once they get there, they realize that, yes, even though these people have a cancer diagnosis, they're people that would be your neighbors, would be your friends, would be your relatives, and they find it very easy to go around and to speak with them before and after they perform. But I always leave it up to the musicians and kind of give them the opportunity to have that choice and that control, because we want to make sure that they're comfortable with the process.
Other thoughts, observations, questions?
Just to follow up on a question that was asked a minute ago regarding, I think you asked it, regarding guidelines for orchestras. I believe it's the Kalamazoo Symphony that has heartstrings, and they have a toolkit that they've developed for, is that? Madison, yes. Yes. They have a toolkit that is specifically about starting this kind of work, mostly I think with senior populations. Yes, yes.
Heartstrings program, if you go to your website, you can download for free, I think, the first chapter, and then it's like a $25 fee.
Yes. There's also a handbook that the Pittsburgh Symphony has created for their musicians, so that would be a good resource as well.
Yeah, I would see what the need would be in your community. What would be the focus? What would the healthcare organization, like who you end up partnering with, and what suggestions they have as to who, what population they think would probably be best, and kind of taking, their lead on that. The nice thing about music and music therapy is there's not one specific population you have to work with. You can work with people from birth to death, any type of disability or disorder, whether that's physical or mental. So there's a wide range of clientele that you can work with.
Yeah.
You said you published the results of the St. Louis University evaluation if they do show a correlation. When do you still publish them even if they don't?
Say the last part one more time.
Would it be useful to publish the results even if they don't show?
Yeah, it would be. we're hoping that we're hoping that it'll work. So, but yeah, you do publish results from studies either way, so that sometimes it can be a learning experience as to figure out what you need to change to get those positive results for the next study. So, but we're hoping that it'll be in our favor.
I was just going to say, in the absence of formal study, I